All right, we are back at it again today. My name is Seth Kalish. This is Dental Student Vibes Podcast. I am joined here by the one and only Matt Havis and George Durakis. Today, we're going to be talking a little bit about the business of dentistry. We know a lot of you guys have been asking more about business, so we're just going to go over some basic stuff. You know, when you get out of school, what do you even do when you're trying to start your own practice? You know, they don't teach you that in dental school. So
They don't. They just teach you how to accrue debt.
Teach you how to accrue debt. That's right. So today, fellas, we're going to talk about business of dentistry basics, and this is a PowerPoint that I'm presenting for the business club. Just real basic stuff. And so on one of these first slides here, I've got a picture of Dumb and Dumber, and that is to emphasize that this is very dumbed down, and we're just going to keep it basic, you know, like Cardi B. Oh, just kidding. She's not basic. Come on. Anyways, we're going to be talking about options after dental school, basic business words, overhead, dental office staff, patient insurance, and how can you tell if your office is successful. And so I've got a lot of this information from a lot of leaders in dentistry, business leaders, people like Dr. Mark Costas, Addison Colleen, really smart guys. So let's start out. Options after dental school. So a couple things you can do after dental school. We do have an episode on this, but a couple options are doing a de novo startup, doing an associateship, and that could be either in private practice or in a DSO. We can also do a residency program. That could be GPR, AGD, or you can go into a specialty program, you know, perio, oral surgery, endo, ortho, whatever you like, right? Another pathway you can take is not just associateship in a private practice, but you can also become a partner. But I would say that's probably not something you're going to do right off the bat, right?
You got a lot to learn. Plus, you have to show productivity,
right,
as well.
So I guess you probably work for a couple years, and then maybe if you know you're producing a lot, you're doing very well, they might ask you to become a partner, and you can buy into the equity of the practice. Couple other options: you can go into the military. That's a great option. And then there's of course a bunch of federal programs, HPSP, a lot of different other programs you can go into. So what are you guys trying to do after dental school?
1 year at a DSO, but I want to really look into the contract that the DSO would want you to sign, because there's a lot of things within the contract that you want to look out for. Like, you don't want to non-compete for so many years for that whole area, and depending on the mileage, like in the radius where you're allowed to practice and where you can't, you want to look into that. I would also like to see what they can do in terms of paying for CEs, because that's huge if you can get them to pay for some of these things, because granted, you know, they're investing in you, and you'll use that knowledge to make them more money for the time you're there.
Right.
So I would like to look into stuff like that for the DSO. 1 year, show productivity to the bank, be able to get my loan, and then try to buy into somebody's practice, and then start as an associate with some sort of, investment into it, and then slowly work my way up, see as the guy or girl gets older, if I can, start buying more into it and eventually take it over, and then have like a seamless transition. That's one of like the top things.
And I'm just thinking about what you're saying right now. I'm thinking back to when we just started dental school. We had no idea about any of that, about showing your productivity to a lender at a bank, right? What that even has to do with for a practice loan. But I want to bring up one of the things that you mentioned. When you start whether you move into an associateship at a private practice and you're saying like work your way up, remember, we got to make sure that you take a look at that contract, and it says in there specifically that the senior doctor will be done after a certain time period. Otherwise, they could just be like, no, I'm just going to hang out for another 5 years, and and you just be stuck in that contract.
Yeah.
Right.
So there's a lot of things to look at, and we could go into some like the in-depth stuff about contracts and what to look out for, what you want to add in to benefit yourself, what are the resources you can use so you don't get taken advantage of when signing a contract. We could go over that in another episode. This is more like the basics right now. So going through the different avenues you can take rather than the details of one specific one.
Right.
So,
how about you, George? What are you trying to do when we're done?
Honestly, I don't even know yet. I still have a lot to learn. This is the first time that I've actually been through this stuff the past few months. But ideally, I would like to do the same thing, work underneath someone for a little while, and then eventually work my way up until I own my own private practice.
Right. I think that's the goal for everybody, right?
Like I said, this is all new to us. We haven't been taught this in dental school.
Right. And I agree with you because do you remember Dr. Golden? He was from South Florida. Where was Dr. Golden from? He came up to speak to us.
Ooh, I don't remember.
I can't remember. He's from Sunrise. Shout out Dr. Golden and Sunrise. His Instagram, I just remember his Instagram was at the Golden Dentist. I think that's what it was. But yeah, I asked him, like, honestly, what is something that we're looking for when we get right out of school? He's like, it really doesn't matter about your percentage of production that you're going to be making in your contract and stuff. The most important thing is to find a dentist that will really be your mentor, because that will give you the most exponential growth in the long run.
Exactly. That's what it's all about. It's almost like an investment. You still, when you come out of dental school, you haven't learned everything yet. You still have a lot to learn.
Right.
Exactly. Like, we were talking to one of our old professors. We saw him at the gym last night, actually, and he was saying that they teach you the basics in dental school just to allow you to practice dentistry. You're licensed to practice, but that doesn't mean you know everything to actually do all the procedures, full mouth rehab, all that stuff. We're not trained in that. We're trained to just do stuff. I mean, I maybe could do a class 1 if you asked me to. But, at the end of the day, you're going to learn, maybe. But, at the end of the day, you will learn everything there is to learn. But you also want to find a good mentor based off of that. I mean, we're on a tangent now, but you want that mentor to be more in line with what you want to do. If you want to focus heavily on endo, you better find some dentist that focuses on endo and probably does it very well. Lots of molar endo, 5-6 canals, all the fancy stuff. You want to be able to focus on that by somebody who can teach you that. If this guy does implants constantly and you can't stand implants, you might want to look at a different mentor.
That's a great point.
Something that is more in line with what you like, because you're going to end up doing things you dislike in a field you may love just because of your mentor. Right.
And then that's one of the things you ask about when you're talking about your contract, and you're looking to buy a practice. You ask them, hey, can you give me kind of like a breakdown of your procedure mix? And then you can kind of figure out, is this an implant practice? Is this, this guy does a lot of molar endo. He doesn't really refer out too much, and you can find that out from looking at the procedure mix. But anyways, let's move on. All right, guys, let's talk about some dental business words that you should be familiar with. So this is just basic stuff, okay? So first things first, fees. So this is how much you're going to charge for your treatment. This can be like how much you charge for a filling, how much you charge for a crown. And then I did a little bit of research to kind of find the norms for stuff. So you're going to adjust your fees every year, usually increasing, right? So that you're in the 80th percentile of dental fees based on reports. So that means, if you're...
So let's dumb down that sentence right there.
So you're going to get a report, and it's going to say like the average breakdown of fees in your area. And if you're charging too little, you're going to be in the 70th percentile. You need to raise your fees, otherwise you're losing money, Okay. If you're above, you better be... you better have some sort of nice practice, maybe one of those like dental spas. You probably got a higher end practice if you're charging a higher fee. Next word you need to know is basically productions versus collections. So production is the full fee for a service without adjustments. And adjustments are like write-offs, friend family discount, coupons. So for example, you do a certain amount of fillings, and you charge let's just say crowns. Let's just say you do a certain amount of crowns, fillings, whatever, and you charge $1,000 for a crown, whatever, and you totally produce $60,000 for the month. Therefore, you've got $720,000 production for the year. Okay, so it's basically just a collection of all your fees. Now there's production of the doctor, and then there's also hygiene production. So that's how much hygiene is bringing into the practice. Now, one of the things that is kind of important to look at when you're signing contracts with DSOs or whoever is if your contract includes collections from or hygiene production, right? Because that's one of the differences between hygiene or between working owning your own practice and working for someone else. If you're working for someone else, you might not be collecting the hygiene production, but if you're working for yourself, you could be collecting hygiene production, and that is more money in your pocket, that and without having to do extra work, essentially. Okay, so collections is the actual amount of money that you're collecting from those the procedures that you're doing, right? So if somebody doesn't pay, that's obviously going to decrease your amount of collections. If insurance doesn't pay, that's going to decrease your collections. So your goal is to have your collections at 98%.
So that's 98% of the time you're collecting the money, like you're receiving the payment.
Right. That's the payments that hit the bank account.
Gotcha.
And a lot of these things that we're going to talk about today are going to be, I'm going to tell you like the ideal number that I've found from research. And it can vary a little bit by a few percentages. But if you're too low, that means one thing. And if you're too high on the percentage, that means another thing, right? Okay, so now we're going to talk about like one of the biggest things when running a dental practice, overhead. So you've got fixed overhead, you got variable overhead. So overhead includes staff expenses, lab costs, supplies, facility expenses. So I'm just going to give you some numbers for those. Staff expenses should be anywhere around 25-30%. And then I've even read that ideally you can get it down to like 16%. Lab costs should be around 10%. And I also found a statistic that you should charge 5 times your lab costs for the procedure. So like, let's say you pay the lab $100 for a crown. How much should you charge your patient?
$500.
Right, minimum. So supply expenses, 5%, facility expenses, 5%. And these are all expenses of like your total budget. That's what the percentages are, or of your total production or collections. A couple other business words. All right, so let's go deeper into the overhead. Fixed expenses. So fixed are bills that do not change in value from month to month. You have lease payments, business loan payments, insurance. Those are all your fixed payments. They're not going to change, right? But when you're ordering supplies, marketing, doing different CE courses, those might change from month to month. So those are going to be your variable expenses. And all of these things you're going to see on your profit and loss statement. So your profit and loss statement, also known as your P&L, that's going to be the statement that shows the expenses, the costs, the revenues, and it's basically the cash flow of the company over a specific period of time. So you might have a P&L for the whole year. You might have a P&L breakdown month by month, right? And ideally, you're supposed to see this all on one piece of paper because they make P&Ls that are like 50 pages, and who's going to read that? Who's going to understand that?
You're going to forget everything. You're going to have to flip back and forth. I'm sure it's difficult.
Yeah.
I've never looked at one, but
Right. So these are all things that you would see either your CPA, your financial advisor, your tax advisors. They would help you in preparing these and evaluating all of these sorts of things. I mean, it would usually be your CPA though. So let's talk about write-offs. That's another word you got to know. So write-off, the definition is money insurance doesn't pay because they thought the procedure shouldn't have been done. So like, let's say you do a filling, or you do a crown, but the insurance says, oh, that caries didn't extend close enough, like deep enough into the dentin or something like that. And they're like, nope, sorry, we're not going to pay for it. Then either you would have to just comp the fee, I guess. I'm not really sure. I'd love to know. So if you hit us up on Instagram at dental.student.vibes or email us at dentalstudentvibes@gmail.com.
give us a follow.
Give us a follow, but let us know. Let's continue the conversation. that would be considered a write-off, right? So other write-offs would be, I think this is considered a write-off, is when you have when insurance pays you only like 80% of your fee. That 20% that you're missing, I'm pretty sure that's like called an insurance write-off. I'm not sure though, but
I think I heard something like that though.
Right.
So I mean, that definitely sounds familiar.
Okay.
But I mean, if there's a CPA around here,
right,
that's listening,
let us know.
Give us a shout.
We've spoken with a lawyer, Kamkari Law. Shout out Kamkari Law. We got a CPA who wants to talk to us. Let us know.
Please hit us up.
Next word, EBITDA. That's a fun word to say. I just like saying EBITDA. That's spelled EBITDA. That stands for a company's earnings before interest, taxes, depreciation, and amortization. So
mouthful.
The purpose of EBITDA is to kind of be able to evaluate where the practice stands in valuation. This is like a common thing you use to evaluate a practice when you're going to buy a practice, merge, sell a practice. And this goes for all companies. So that's EBITDA. So that's like, let's just say you're like totaling $1 million a year, and that's before everything. But the thing is, that doesn't necessarily tell you the cash flow, because then there's cash on cash flow, and you compare cash on cash flow with EBITDA. But we're not going to get into it because will be a lot more to talk about. So overhead. All these things are really, you allocate your overhead by percentages, and everything should kind of hit this ideal percentage range. So like we said before, staff should be around 25, lab around 10%. So that's how you kind of allocate all your overhead into percentages. Then about 30% should be the doctor's take-home pay, and then additionally, if you're doing very well, you should have about a 10% profit, and you can use that to reinvest in your practice. Now these are all like, I'm not saying these aren't like absolute numbers. These are they're adjustable, right? And that they adjust according to the growth of your practice. So ideally, you want to have between 50 and 60% overhead. I mean, having a lower overhead is great.
If you could do 30% overhead,
Yeah.
I've never seen it before, but if you could do it, shoot for it.
Yeah.
By all means, 70% in your pocket, why not?
Right. So I got this from Dr. Costas. He has this 3-phase overhead plan. So if you improve your overhead, it's basically more money in your pocket, right? So there's 3 phases. Phase 1 is a 30-30-30-10 split. And that gives you, this is at the 60% overhead phase. So there's 3 30s and 1 10. It's 4 parts. It's 30% payroll, which is you're paying for your staff salaries. 30% expenses, so that's your fixed and variable expenses. 30% doctor pay, and then 10% goes to profit. So this is at 60% overhead. If you can bring your practice down to 60% overhead, you're doing well, right? You're doing good. You're on your way. So once you really get your things in order, and you move to phase 2, and then phase 2 is basically decreasing your expenses. So now we have, instead of 3 30s and 1 10, now it's 30, 25, 30, and then we move that 5% that we saved in expenses to profit. So I'll just go over that again. You're still at 30% payroll. Now it's 25% expenses. Remember, expenses are lab costs, equipment, supplies, stuff like that. And then still at 30% for the doctor pay, but now we're at 15% profit. Now if we move to phase 3, now we're going to be able to reduce payroll percentage of overhead. So now you're at 20, and then move that to your profit. So you're at 25% payroll, 25% expenses, 30% doctor pay, and now you're at 20% profit. And this gives you a total of 50% overhead. So why do we want to increase the profit?
To invest more.
Right.
To buy more things for the practice. Let's say a nice CBCT, You could use that for expanding the building if you need to add more operatories.
That's a great point, yeah.
So, I mean, but the other thing too is if you guys are thinking, oh, wow, so you're only going to make 30%, but it's 30% relative. So in phase 1, you're not going to make as much money as you're making in phase 3. In phase 1, you might be, 25, 30 years old, and, your production is going to be, let's say, 600 grand a year. So you're making 30% of 600 grand. But let's say once you're in phase 3 and you're at the top of your career, you're, late 40s, and you're just a cash cow. You could be at, let's say, a $2 million production for your practice. You're going to take 30% of $2 million then. You see, like, how that works. I mean, of course, you got the taxes, inflation, whatever. But, I mean, you're going to be making more based off of your percentage for what your practice is. So that 30% is of your total. So you're still going to make money, and you'll eventually start making more. So it's not like you have to increase your percentage that you pay yourself.
Right. And this is all credit to Dr. Costas. He came up with this, and I think this is a great way for us to all learn and understand about overhead. So that was moving from phase 1, 2, and 3, going from 60 to 55 to 50% overhead. So how do we actually do those things? How do we move up in these phases? How do we save on the expenses? How do we save on the staff? So to decrease your variable expenses, you're going to, first of all, one of the most important things is actually keeping track of this stuff. If you don't keep track of it, if you're not watching your metrics and everything, you're never going to know what's going on, right? So how would you keep track of this? Where would you look at it?
Your profit and losses.
Profit and loss statement, right? The P&L. Right, that's the ultimate where everything's at. You're gonna also want to keep control over your inventory, and then also you want to make sure that, I know it seems like it's easy when you order everything from one supplier, and it's just easy to start just clicking all the way down the list of all your supplies that you need, and then just ordering that whole shipment from one supplier. But if you go to different suppliers and negotiate with them, you're able to get lower prices, and it might take some more time. I mean, you could have, your office manager or one of the lead dental assistants, something like that, order the supplies for you and go to these different suppliers. But in the long run, doing this is going to save you money, right? Because you're paying less for supplies. So that's how you would, negotiating and just checking different vendors is going to help you lower your supply costs. So for the fixed, those are the variable expenses. For the fixed expenses, the number one thing to decrease these percentages, you're going to want to increase your revenue. So obviously one of the ways to lower these is to increase your overall production and your overall collections. Basically make more money so that your money spent is less overall in proportion. So couple ways you can decrease your fixed expenses. To decrease the write-offs, you can drop some of the insurance plans that you take, some of your contracts that you have with the insurances, right? You can also increase your service volume. You can increase your prices, how much you charge for each procedure. You can increase your case acceptance. How would you do that?
Communicate with the patient better bedside manner. If you can connect with the patient and then they actually feel, like they could feel your empathy towards them, you're going to be able to sell them on more things. And it's not like a used car salesman where you're like, oh, you got to get this, with this package and these features. It's not like that. You want to be able to, make it seem worthwhile to them that they need to do these things. Like if you want to sell them, let's say an implant, you have to explain to them the bonuses of having the implant versus doing a bridge, like bone loss, whatever you want to talk about. You got to be able to sell that to them in layman's terms in ways that they'll understand. I'm sure these patients are brilliant in their own field, but they're coming to you as the dental professional because they don't know about teeth, unless they're their own dentist, but that's a different story. So you might have a really great engineer who doesn't know anything about teeth. Explain it to them the way they would explain engineering to you. That's how you do it, and that's how you keep a very high case acceptance, and you'll sell very high quality cases. And all the older guys or whatever at the school and like everything, they always tell you never sell a super expensive case like treatment plan to a patient the first time you meet them, because it just looks like you're trying to make money off of them. See them, get to know them, and then on the next visit, propose the plan of what you want to do. Don't whip out a $60,000 treatment plan, within 20 minutes of meeting this person. They say, there's different tips and tricks. Plenty of people, write books on it.
I've never heard that before.
Seriously, that's one of the doctors at our school, they say that all the time. They're like, I've never went into the operatory, sat down and said, hi, listen, based off reviewing your chart and your x-rays or whatever, I have a $60,000 treatment plan that you need. Because then they're like, oh, you're FOS. We don't need this, and we're out. And then you just lost a patient. They go to the guy down the street. And if they have some finesse, they're going to do it that way. And then once you build that trust, you can start selling them on ideas and plans.
But you still have to tell the patient after your exam, you have to share with them your clinical findings and what their best options are. I think it's more about
maybe the different
giving them options, maybe allowing them to have autonomy.
Exactly. Don't lead with the $60,000 plan, because you could put together a plan. Like you could say, oh, I want to do a full mouth implant case for you, or you could say, all right, I could do a full denture. And granted, you're going to make money on either one, whatever you sell. But at the end of the day, you're going to make money for yourself you're going to make a lot of money if you do the full implant case for the mouth. But at the end of the day, it doesn't matter what you do, as long as you can sell it well. If you could sell dirt to a ditch digger, you'll do great in dentistry. You want to be able to sell things. If you could speak to people and connect, that's how you will make money.
And the point isn't necessarily obviously it's important because we want to be able to sell the treatment to the patients, because we know this is what the patient actually needs. This is what's actually going to improve their health and improve their life.
Yes.
That's why we want it. It's difficult I feel like the biggest reason, I'm sure lots of people will agree, the biggest reason why a patient would say no is because they truly don't understand. The biggest reason they say no is they have trouble with money, or they're afraid of the pain, but they just also don't truly understand the benefits of having dental treatment and improving their oral health, right?
Oh, I agree. Or they don't trust you too. That's
right. So you got to build trust.
Yeah,
but
you got to build that rapport.
I think we should definitely have another episode on this
case
topic.
Acceptance.
On case
Absolutely.
acceptance.
You could go on for hours about this stuff.
Okay. So one of the last things for decreasing your fixed expenses, you want to increase the mix of procedures that you're able to do. If you're only doing fillings and crown and bridge, which that's the majority of all general dental practices, that's the majority of their procedures that they do. But if you start doing, let's just say, molar endo, you start doing your own surgery, stuff like that, instead of referring out, obviously you're going to increase your overall production, and this will decrease the proportion of your fixed expenses. All right. So let's talk about another part of business, right? Your HR, your human resources, your staff, right? Well, so that's part of your overhead.
That sounds terrible.
Let's talk about some of the regular dental office staff. So you've got front office, back office. Front office is, and this is just for a small private practice, right? Because you could have in a big organization, you can have an accounting department, all that sort of stuff. Yeah. But so front office, you have front desk. Those are the people that when you walk in, they say hi. That's probably one of the most important jobs, hands down, because that's immediately how the patient's going to judge the practice.
That's the first impression right there.
Right. You have a patient coordinator. That could be for either specialists, or you could have a patient coordinator just for Invisalign, and these people are going to basically set up special appointments and help with the scheduling. And a lot of office managers and front desk can do that as well. You don't necessarily have to have a patient coordinator. So the office manager, that's another important staff member to have as part of your team. And the office manager, I feel like you should really kind of treat them as your right-hand man or woman, because as the dentist, you're taking care of a lot of the clinical stuff, and, you got to delegate things out so that you can focus on the clinical and on treating the patients, right? Another important staff member, team member, is the billing or insurance specialist. And, these are all really just depending on the size of your practice. If it's just you're in a small town and you have a very small office, it could just be you and one other person who just runs the front desk. So, or you can, like I said, you can have a big practice. So that's front office. Those are just some of them. You can have others. Back office. So back office includes hygiene, dental assistants, And so these are going to be like the people that are actually in the back of the office working with you, treating the patients. So if you end up having like a large back office team, in addition to a large front office team, you might want to eventually get team leaders. So like you have a hygiene team leader, you have a dental assistant team leader, and they kind of manage everybody in that team. And then so if you have like, you could have just like a back office meeting, and then those team leaders will like report about their own individual teams.
So it's like a chain of command almost.
Yeah, it's a chain of command, and that's one of the most important things is being able to trust and hire people appropriately, and then delegate out your responsibilities so that you can take on more patients, take on more business, and you won't be as stressed out. Because everybody's got like a threshold. You can only do so much, and that's, I don't need to say this, is the importance of teamwork it's synergistic, right? So all these people, absolutely crucial to your success. And
absolutely.
A happy office is a successful office.
You bet. But the thing is, though, this is the hardest part of dentistry, is managing the personalities. You really have to look at who you hire. It is so difficult for dentists to, have a good, like, just gelling office where everyone gets along, because, people have their own opinions and stuff, things happen, and they don't exactly get along. So you have to manage them as well. You're like a babysitter sometimes, but you don't want that. You want to be able to hire people that get along, they're professional and everything. That's the hard part. You got to be able to hire good attitude and then teach them the talent and the skills that they need, because you can't teach attitude.
Right. Okay, next topic of business here, patient insurance. So this can be 1,000 podcasts on its own.
You can make a different podcast.
There's CEs on just insurance. There's CEs on just like coding and stuff like that. So I'm going to make this very, very basic, okay? So we've got, let's just say 5 types of payments. So the whole point of insurance is so that patients don't have to pay for the whole treatment out of pocket. They pay insurance each month and they're good to go. First insurance we want to talk about, fee-for-service. And what is that? That's not insurance. That's basically cash, right? So your fee-for-service, also known as FFS, right? That's how it's abbreviated. You'll see it. Fee-for-service is just cash, and that's like the full price, right? So like we said earlier, $1,000 for a crown, they're going to swipe their card or hand you cash, and that's going to be $1,000.
That's
right?
Nice.
And that's going to be for every type of treatment. So that's kind of like a standard, and that's when we said earlier, you're going to want to charge in the 80th percentile at least, that you're comparing fee-for-service, your fee schedule for fee-for-service. So next, we have PPO, HMO, Medicaid, Medicare. So these are 3 types of insurances. Okay. PPO and HMO. Basically, PPO and HMO, the patient's going to pay a certain amount, and then they're going to have certain procedures covered. Now, dental procedures are broken down into different categories, and the categories are part of a fee schedule. So an insurance fee schedule will be broken down into preventative care, basic, major restorative work, periodontal care, like specialist cares, and so the insurance will pay a percentage of each one of these types. So a common percentage we would see for a PPO plan or HMO plan would be 100% for preventative and for basic, or 100% for preventative. So that's basic, or preventative is basically x-rays, exam, cleaning, right? So just think, maybe you've been to the dental office and you've got an exam and cleaning, you haven't had to pay a copay, right? So next is basic, and those are like fillings. And think maybe you've gotten a filling before, but you've only had to pay $20. And basic is covered at 80%. So when you're usually charging, in the hundreds of dollars, but you only had to pay $20 or so, most of it was covered because you had this fee schedule. And then major, like crown bridge, and then also perio and root canal, stuff like that, those would be covered at 50% by the insurance. So they're only going to pay half of the procedure. And so what's kind of the difference between PPO and HMO? That's kind of a big question. From what I understand, HMOs usually cover less than PPOs.
That's exactly it. PPO is better to have. That's
Yeah.
very, very simply.
Yeah.
PPO covers more. And then in terms of, let's say, medicine, for instance, they allow you to see specialists, and you get to pick. You get to pick who you want to see.
Right.
So HMO, they give you a list of people. They might be BS, clinicians that don't do a very good job, but they accept the HMO. And it's true. I mean, I took a class on this in undergrad. So, like, an HMO doesn't give you the options and then as good of quality care as you could get on a PPO.
It's a smaller network.
Yes, exactly. Right? It's a smaller network, and then you're not going to be able to pick.
And they don't cover out of network. But some PPOs cover out of network.
Yes, PPOs can, depending on like whatever plan you have or whatever, but the HMO does not. They say you have a list here, pick one. PPO, you kind of have more broadened aspects of what you can do. So overall, I was always taught in undergrad when I took this course, it was phenomenal. It makes you a financial, just independent person. And my professor said, when in doubt, always go with the PPO because you'll get the better care. And it'll be, it's just better for you and like as a person, you'll come out better from the surgery most likely and everything. But, at the end of the day, PPOs. A lot of dentists take fee-for-service and PPOs only. They don't even bother with the HMOs. So I follow a page on Facebook, and they were saying that if you take HMOs, you're in trouble because the HMO plans are so hard to get payment out of them. They fight you every step of the way. They don't want to pay what they should pay, and it's a pain. And then it just causes stress in your life that takes away from doing the dentistry.
Right. And then the next one is Medicaid, Medicare, and that's basically insurance covered by the government. And it's going to cover, it's really not going to cover that much. One of the last things I want to mention are payment plans, and that's essential to any office, right? This is how you're going to be able to, a lot of patients can be able to afford treatment. So one of the most common payment plans is Care Credit. And Care Credit, it's basically like, I guess you could say it's almost like a lender, and they're just going to, like for $1,000 crown, the patient will pay $100 a month for 10 months. And so you can accept Care Credit at your office, but Care Credit will take 15% of the fee. So like they're only going to pay, or you're going to receive less money in total. But now the patient will be happy and they'll accept the treatment because they can actually afford it because they'll be paying monthly payments. Okay, so that's just really quickly on insurance. Just touching on insurance. So last thing here, how can you tell if your practice is doing well? So these are called key production indicators, and these statistics are really what you're looking at overall to determine how your practice is doing. Okay, so we'll just go through these really quickly. So we've already talked about production. So one of the important, and these are also abbreviated as KPIs, the key production indicators. So net monthly production, that's an important KPI. We already touched on that. Overhead, we said that that's about 60% or less. That's doing good with your overhead. Collections, 98% or more. You don't want the money to slip through the cracks. You don't want your patients to never pay you, right? New patients per month. So this can really vary, but from what I've seen, around 30 patients per month is good, per doctor is good, or you're doing well, right? Another important one, this can gauge how well your doctors and your hygiene are producing in the practice. This is doctor production as a percentage of overall production. So ideally, you want to have about 75% of production to be doctor production. Therefore, that other 25%, that'll be from hygiene. So we say that usually your hygienist, you usually want to pay them 3 times the amount that or you want a hygienist to produce 3 times their salary, right? So if the doctor production percentage is low, that means the doctor needs to produce more. But if the doctor production percentage is high as a total of the overall production, that means that hygiene needs to produce more. So that's how you can kind of gauge how your employees are doing if you have associates or hygienists. We spoke about insurance write-off percentage. That's an important KPI. Your lab percentage of overhead, supply percentage of overhead, both at 5%. Those are also important KPIs. Staff payroll as a percentage of your overhead. And like we said earlier, you want to get it to around 30%. And then according to Dr. Costas, your target should be at 16%. And that seems like it's pretty difficult. Your production per chair. So this is your net production divided by your number of operatories. And this is an important KPI because this can kind of help you gauge whether you need to expand, or you can kind of estimate how much, by adding more chairs, more operatories, how much more you can produce as an office. And then, of course, your daily production as a provider. So a couple other KPIs, those are normal KPIs to look at to see how your practice is running. So a couple other KPIs that will help you get ahead. Case acceptance percentage, right? That we spoke about case acceptance earlier. That's very important. Your production per hour, your missed appointment percentages. I know a lot of offices have policies, some on how many appointments a patient can miss until they're dismissed. A basic number would be like 5 missed appointments, and then you send a letter of dismissal by certified mail to the patient and say, sorry, because you've missed X amount of appointments or 5 amount of appointments, we're no longer going to see you, right? Because that's kind of wasting your time. You could have had a patient in the chair and given them treatment, but no, the patient missed the appointment.
But some people actually charge for that.
Yeah.
They charge like a 50% fee
Right.
of the appointment automatically if they miss.
Right. So, hey, whatever your office decides to do. Next is the attrition rate. So attrition isn't like dental attrition, tooth on tooth. It's actually the number of patients that leave your office over time, right? That's important to recognize. And if you're also looking at this over time, right? So if all of a sudden your attrition rate starts increasing a ton, you're like, well, what's going on? Why are so many patients leaving my office? So this also has to do with the reappointment rate and your active hygiene percentage. These are 2 other KPIs. And that's kind of like, how often are your patients coming back? Do they just come for one exam and cleaning and they never come back? If that's the case, what's the reason for that, right? You don't have any retention of your patients. And then one of the last KPIs is your incompleted treatment total. So that goes along with your reappointment rate. Do your patients actually finish their treatment? So do they only come in for that first filling with the patient with the tooth that's bothering them, and they never come back for the other 5 crowns they need because they're missing half the tooth structure? So that's another important KPI to look at. And you can think, if some of these are low, you can think, okay, well, I'm going to work on this month. I'm going to really try and raise one of these KPIs and work on this KPI this month. So these are all things to look at. We're going to have a lot more topics to come. We want to talk about more about associateships, student loans, talk about finances some more. Definitely going to get into practice acquisitions. And like we already said, case acceptance. We're also going to go over marketing. And we're going to also talk about location analysis in the future. So I hope this wasn't too much information. I know it was a ton, but I hope you guys stayed with us. It was a lot of information, I know. You guys have any last comments, last shout outs?
I'm very happy if you guys listen to this whole thing. I understand we're moving on over 40 minutes now, but if you guys listen to this and you actually pay attention, and if you get something out of this, you'll be able to have a normal business-based conversation, just in general, because this is how other businesses are run as well. Dentistry is just a healthcare business. You'll be able to do all of this with anyone. You can talk to businessmen, businesswomen. You'll be able to do this, and then you actually know what they're talking about. You can feel like you're part of the conversation rather than just saying, I don't know what's going on. So this was super, super valuable. I even learned stuff, and I've been through some of this. So, super valuable.
Right, and if you guys have any questions, any comments, you want to continue the conversation, I'm sure I've made a mistake. I've made 1,000 mistakes in my life. I'm not perfect. But if I missed anything, if there's anything you want to learn more about, if you want me to send you the PowerPoint, the presentation that we made, email us at dentalstudentvibes@gmail.com and message us on Instagram at dental.student.vibes.
Give us a follow.
Subscribe, follow. But yeah, thank you guys so much for listening. We hope you guys learned a ton. And until next time.